Organisations, including the NHS, social care, health and the voluntary sector, are all coming together to transform the way that we deliver our services for community health for all our populations. This work continues to build on the progress already made since 2019 and will continue to focus on improving the quality of life for our residents with moderate to severe mental health problems. So, what do we mean by transformation? It means a much more joined up approach to care and removing the barriers that have previously existed between our primary and secondary care mental health services. It means a range of mental health professionals, GPs, social care providers, the voluntary sector, community groups, and of course people with lived experience working together to create a more flexible and accessible system for people who need care. It means putting our service users and carers at the heart of how we design and provide our services.
As a GP, we tend to see a lot of patients who access general practice for mental health needs. If we can provide them the right support at the right time, the number of times they access services would reduce, reducing our workload as well. By improving communication with our other organisations, we also help our patients further.
So these areas are really important because we know that mental health services are overstretched and we need to do something different and think outside the box. So this transformation is enabling us to question everything and try and fill in the gaps where there is blatantly gaps.
The transformation programme is all about ensuring that we are creating better services for our local communities. And there are certain key areas that we're looking at. Those include disordered eating, BAME access, carers, the experiences of people with complex emotional needs, older adults and younger adults.
I believe that we should understand people's health, well-being, their mental health in the context of their lives and understanding the communities that people live in.
I think the part of the transformation that excites me the most is working across different sectors. So for me as a community connector, I work in primary care, secondary care and across the community. And I think so often we work in our silos, so working in an integrated way is really important for me.
Historically speaking, stigma has been a problem in terms of engagement. But in the new way of working, we're trying to take the care to the community. And we hope eventually that we'll be able to make use of community centres to provide the support to the community so that when they come to access the support, they're not coming to a mental health building, but they are coming to a community centre, for example, to seek help. So we hope that will increase or promote engagement with our residents.
The fundamental purpose of the transformation programme is to improve the services that we are providing for our local citizens. And we can't do that without actually asking people who use our services what changes they want to see.
I think it's really important in the development of the transformation to hear more from service users, to hear from the voices of the people that we're supporting, and also to have more community programmes involved.
It's like if the NHS is so paternalistic, it is so, we'll take care of you, we'll fix you. And I think undoing a lot of that mindset is a key part of the transformation. So that's what I've been kind of pushing for. But it is really hard to do that because, people are so set in their ways, as you said. So I think, it's about trying to change that.
The culture needs reforming.
Exactly.
And it's not going to be overnight, but at least the transformation project is starting that transformation. So I'm quite hopeful about the future. Rather than just treat symptoms, that's the problem with psychiatry of today. They just treat the symptoms, you do not investigate the cause. And I'm sorry to say that's not logical in terms of medicine. Medicine finds causes, they don't just treat symptoms for life. And that's what needs to be done, education and awareness, structural reform and structural change.
I think as health professionals and as society, we should be emphasising less that we're trying to fix the individuals and individual suffering, but rather to help people to have meaningful connections and participation in their communities and wider society.
Yes, I think this transformation project matters
because it's giving people like me a voice. I think it's a positive that you come together with your peers in that transformation project and share point of views and bounce off each other. It's like a therapy almost.
Mental health is a journey where it cannot be done alone. One needs the support of every other channels or other avenues that can help towards recovery.
Community Connectors is a programme designed to support people with mental health issues in the London Borough of Newham. We know the community here at Community Links alongside our partners, and we know that we can branch out and reach people in a way in which statutory and clinical based services perhaps haven't been able to in the past.
I grew further away from madness. I got discharged again, this time never to return to hospital ever again.
So having these all professionals together, I can see it's going to have a positive impact on service users' mental health
In the long run.
on the long run and social connections and so on. Overall, I would say it's going to be very, very good.
Yeah, definitely, especially since it's because of the transformation we've become so much more integrated, so now it's more of a holistic approach to helping service users as much as we can.
So we've achieved so much with the transformation, and I think the reason being is we're thinking outside the box and we're creating flexibility and we're responding to the needs of the community rather than us creating something that's four walls and sticking to that. So the fact that we can respond to the needs of the local community has been hugely successful, and we need to make sure that we continue to listen and continue to respond and be flexible.
It's a big change, and change can be very unsettling at times, but we've come so far, so we'll continue improving and looking for ways to do so.
By working in collaboration with organisations, service users and carers, we will ensure that we deliver care that meets the needs of our diverse communities and is able to respond to new and emerging needs in light of the pandemic. We will achieve this by continuing to listen and work together, by strengthening relationships between ELFT and its partners, including local third sector and grassroots organisations, and the communities we serve, who have for many years experienced structural inequalities which we must now address. Thank you very much for watching. If you would like to join us on our journey, please visit us on our website at elft.nhs.uk/services/community mental health transformation.